My name is Samuli Ripatti. I'm a professor at University of Helsinki and I run a research group at Institute for Molecular Medicine Finland, which is FinnGen, which is where we are standing right now. I'm interested in the genetics of common complex diseases. That means diseases that touch in one way or the other all of us or our neighbors or our friends or our relatives, such as heart disease or diabetes or common cancers. So all of these common complex diseases are such that the risk of getting the disease is dependent both on what we have inherited from our ancestors and what is coded in our genome, as well as our lifestyle choices and the choices that we make over the life course. So the FinnGen project has been developed by the biobanks in Finland and the research institutes, including FIM, where it's coordinated. And that has been one of the key resources for all of this research. The fact that FinnGen has pulled together large enough number of individuals with both the genetic information in the background, the health history of these individuals, as well as the health information that has been gathered over the decades, that's been crucial for the research that we've done, and that has given us opportunities to test these algorithms and the risk scores in Finnish population, where otherwise we would have needed to go to other countries and then wish that they would work also in Finns. So there are two key findings that have come out of the recent studies that we've done on the FinnGen data. First of all, when we look together both the clinical risk factors and the genetic risk scores, it's clear that both contribute to the risks of the diseases that we have been studying, which is the heart disease, diabetes, atrial fibrillation, breast cancer and prostate cancer. The second of all is that while the clinical risks or risk scores have been developed and behave relatively well for middle-aged or older individuals, they actually provide relatively poor information for young individuals. And this is where the genetic information particularly provides additional value in identifying individuals who are in high risk of these diseases, and then some opportunities to either lower their risks, depending on the disease that we look at, or at least being able to detect the disease early on in their lives, so that, for example, the cancer hopefully have not developed very far yet, and the treatment are easier for the individuals. So the fact that in FinnGen the biobanks came together and pooled the data for FinnGen is a key component of the research. And because you cannot really study these types of things in small scale, in small studies, or actually not in individual biobanks in Finland either. So the fact that a small country put such a big effort of pooling the data has been crucial for the research, and that's what has made it possible.